Would you say being in a radiology technologist is for someone who is on the shy side? Yeah. So there are so many things you can do in medical imaging or radiologic technology. You have over 11 modalities. Some of them deal with patients and some of them don't. Medical dosimetrists, they don't deal with patients at all. At all, at all, at all. And they are part of our profession. Who else? And that's, I'm not saying dealing with patients is bad. I love dealing with patients. I like them. I get bored when I don't get my dose of patients because I'm work, not full time, but I work as needed. I don't always. And then some days I don't work. Some months I can't work because I'm busy doing other stuff. But I'm going to tell you, I love going in, doing my PRN, doing a agency job, contract job, because I enjoy the patients. But there are leadership, education, director roles, sales, clinical, so many different avenues you can go in where you do not have to, if you don't want to. Everybody's not a patient person. And that's okay, but you can still go to school, get the degree, and use it in another way. Good question, though. I'm currently X-ray tech, but limited scope. Can I go straight to CT, MRI? Joshua, you know that answer. No, you're a limited technologist. So maybe an LMRT. Some of you don't know what an LMRT is. LMRTs, they do study radiology, but they only can work in a limited scope. They could take certain exams, but they are not registered radiologic technologists, and they can't work in hospitals. So as LMRTs, so that limits what you can do. So no, you cannot and should not be doing CT and MRI because you didn't go to school for it. You have to be certified to work in those things, and you should not be doing CT and MRI. Now, I have seen LMRTs doing CT, doing MRI. They should not be doing MRI. So then this is the thing. Anytime you hold any kind of medical license, there is documentation. When you do exams, there is a digital footprint that is left every time you touch a patient, whether you're transporting a patient, whether you are going over, your name is digitally attached to every patient you deal with. Okay. Just think about that. So if you're working under an LMRT license, some kind of way your digital handprint gets on that exam for that MRI, that patient come back and sue, they check it out, you lose your license. You lose it all because you're not practicing under your scope or somebody telling you or the patient, whatever. They could be 5-10 years later. I'm telling y'all, you have a digital footprint on everything you touch in the hospital, whether you scan your badge in that department. You can say, well, I don't work in that department. It wasn't me. They're going to go through the records and say, well, Joshua, you scanned into the MRI department on this day at this time. They're going to go back at your clock-in records. When I tell you they check everything, they check everything. So do not do what you're not supposed to be doing. Don't let anybody, a doctor or anybody, talk you into doing it because it messes up your future ability to become an ARRT registered radiologist, radiologic technologist. Hope that's helpful. Not saying that you're doing it, but I'm just giving some friendly advice. Kay says, I passed my ART back in March, but I still feel like I lack confidence in doing x-rays. Well, keep doing them, Kay, because that is how you get confidence, is by doing it over and over and over. And I don't know, Kay, do you work at the same hospital that you went to school for? That you went to school at? Because this is what I find. When you get a job where you went to school at, after all those 2 years, they know you, you know them, you're not challenging yourself. So if you go somewhere else and get a PRN somewhere else, nobody knows you, you don't know, it pushes you to not rely on what you've always known. Hope that helps. Dog, I skipped a lot of questions. Do you think MRI tech school only for someone who's in their 47 is a better option? Is 47 is a better option? Whatever works for you. That's number one, Lilma, whatever works for you. But I don't think age has anything to do with it. Check out the video on YouTube. I'm telling you, check the video out on YouTube. It is very good from a perspective of how your age can work in your favor. I'm going to tell you, your age will work in your favor. Don't sell yourself short. You're actually in the prime of your life. You know what you want. You know what you're going to do. You know what you're not going to do. You're not wishy-washy. You're not trying to figure things out, usually at this age. You are in a great position for going to radiology technology school because, as I mentioned earlier, when you go to school for radiology technology, everything else is open to you without having to go back to school for 2+ more years, right? Yeah. Which state do you think is easiest? I don't know. I'm not sure of that question. What state is easiest for what, Swaggy? You in New York City? Getting a job, maybe? It depends. It depends on you because I see people that say they live, say, in New York City and they can't find a job. But then I see other people in New York City just got out of x-ray school and they cross-training into CT. So I don't know. Maybe you have to look at, do you have your registry? That's the first thing. So you have 3 years to take your registry. Some people not registered. If you don't have your registry, yeah, you're probably not going to get hired. chances are slim. If you came from a place and maybe people knew you and it wasn't a good reputation, we have a small community, people talk. If you were a student and you're trying to just work at the same place, go out to another place, try something new. Yeah, a lot depends, but I don't think any state is easy. Now, of course, there are some states with a lot of jobs, but everybody can't move. That makes sense. I don't know how to answer that one, Swaggy. Give me a little more information. But let's keep going. Thank you, Ocean Free 27. Thank you so much. Are you able to get your degree in ultrasound tech, then get certified at Rad Tech? Brittany, so I answered that one early. No. You have 4 primary pathways: nuclear medicine, ultrasound, radiation therapy, MRI. You can only do one of those things. Can't do nothing else. That's all you could do if you go to one of those primary pathways. If you take the other primary pathway, radiology technology, cross-training to MRI, CT, interventional mammography, bone density, you could do those on a job. No schooling required. Radiation therapy, nuclear medicine, ultrasound, you could take a year certification course and go into those because you have that radiologic technology degree. I'm just a messenger. I'm just a messenger. No hate on anyone. Do the one that works best for you, but just know your limitations when you do the other primary pathways. You are not going to be able to do anything with radiation, anything. So, and it's all on the website. And then if you go to different state licenses, they would tell you. The state had their own rules when it comes to licensing. The ART might let you do something. Your school might let you do something. One state might let you do something. But another state say, no, you're not doing that here. I don't care if Florida let you do it. Come to California, we ain't letting it happen. And a lot of states, they have their own rules when it comes. That's why you have state licensing. I started the X-ray program in August. I feel anxious. The phone, Castle Library, congratulations. Chris says, I'm 39 of age, too old is 39 years of age, too old to pursue radiology. Chris, no, you're just in the prime of your life. Again, I think over 30 puts you in a position, like when I went back to school in my mid-20s, early 20s, but I had lived on my own. I didn't move out of my mother's and father's house to X-ray school. I was living on my own in a whole nother state, had my own business, everything, and life happened. I knew when I went back to school, I ain't have no more chances. So I was locked in and focused. Those are the kind of students that they're looking for. And usually when you're older, I'm locked in, I'm ready, I'm going. I'm not playing no games. I'm not here for the fraternity parties. I'm not here for the college experience. I'm here because I got to work. I got kids, I got a mate, I got trips I want to take off. There was a group of guys, they just finished radiology school, MRI school, radiology school, and they're MRI techs. 4 of them, they just put this TikTok. They was like, this is so much fun being on travel assignments with your bros. That's how you're supposed to enjoy your life and your career that you work so hard to get in. Get out there and make that money and have some fun. If I was traveling and single and did travel work single, and had a group of friends too that we all were in the same field. Yes, yet we'd all live in a little room together and collect that money. We will make it work. We will make it work. Is applying to 7 schools too much? No. That is so smart. I say apply to every school that'll take you. Apply to every school because you don't know. I applied to 4. That's all I had when I applied. And only 2 took me. Imagine if I only applied to 1 and that was the one that didn't take me. I applied to all 4 and 2 of them said yeah. And then I was able to choose which ones I wanted to go to. It's all about having the choice, not letting somebody else make the choice for you.